which included one of my seniors, Dr. Sudhapai, who is right now in Loma Linda University. She was also our PG at that time. So 2-3 people I can recall and say that these are the people who made me understand the ECGs and see to it that I am good in these issues. But word of caution, you should never get a feeling that you are perfect in these things. With every new ECG that you learn something new. So you should always have your mind open, and you should learn from your seniors as well as others during the teaching round. So the level of perfection is only the expectation, but the reality is that you should keep it going throughout. You should never think that I know everything in life as far as clinical medicine is concerned. There is always a surprise around the corner, and the curiosity to learn newer things, arrhythmias, all these things should be there. So with these few words, I have great pleasure in inaugurating this pre-conference workshop on learning electrocardiograph. And let it be again remembered that no investigative advances will solve the problem unless the human values are there in a doctor. And Father Muller's has been an excellent institution in inculcating these values. So thank you very much.
Thank you, sir. I request Reverend Father Patrick Rodriguez, Director, Father Muller Charitable Institution, to deliver the presidential address.
Dr. Prabhu, the respected Dean of KMC Mangalore, other dignitaries and participants in this pre-conference workshop. Some years ago, when I was working in St. John's Medical College Hospital, Bangalore, we had a medical superintendent there for quite long times serving the hospital. His one statement is still familiar and ringing in my ears. Very often used to tell me and others too. He used to live in Fraser Town, and from the moment he left St. John's and reached Fraser Town, he could meet about 200 doctors. He could meet about 200 doctors on the way, see their clinics or whatever, but not a single electrician or plumber. That was his regret. I can meet 200 doctors but not a single electrician or plumber, because that is considered to be very low. There are no takers, but that is very essential that he could not get it. His regrets all the time. When I see this conference organized on ECG, I just wonder or get the same feeling probably. We are so much interested in details and advanced things today. Probably some very serious interventional cardiology procedure, if there was demonstration, greater interest could be there and bigger crowd would participate, maybe. But some things simple, ordinary, that can be used for the diagnosis and treatment of ordinary people or all the people all the time, sometimes the interest is lacking. Few days ago, there was a publication of a study made by Harvard University. NCDs, non-communicable diseases, their impact on the economy of the world and economy on the country. The economic burden, because people at the young age, we call that as earning age or productive age, because of the illness during that period, what is the amount of loss of productivity a country has? They worked out. Figures are staggering. And in this, cardiac problems, the prime place, important place goes to the cardiac problems. So whatever efforts made in addressing this problem certainly goes in a long way, not only improving and maintaining the lifestyle and the quality of life of people, but also reduces the economic burden that can be there on the family, on the society, on the country, because people have this problem. In this, ECG, I'm certain, plays a vital role. There are organizations today where ECG or also physicians do that even in rural areas, when the report can be from there, can be sent to cardiac centers where experts read it, give the report, advise the general physicians how to treat the patients. Now this is a great thing, a great help for the general physicians. I'm very happy that the medical college cardiology department, along with the medicine department, has organized this workshop, especially the young physicians. Maybe even small thing, ordinary procedure, expertise is what is called for. And this expertise could be acquired by this type of workshop. I'm very happy to note that our chief guest today mentioned about human qualities. This is something that I always mention when I talk to the address medical students or the doctors. The survey made by Mayo Clinic a few years ago among the patients in Rochester Center, and there's another center, Mayo Clinic has the Mecca of medicine, to the campuses. The survey was done in both the campuses, more than 1,000 patients. Question asked was, what are the qualities that you expect in a physician who treats you? What are the qualities? Now, your profession is for teaching, molding the younger generation in this great profession, and also treating the patients and trying to deliver health to them. Now, what are the qualities? He spoke about, Dr. Prabhu spoke about some human qualities, and there, this survey in Mayo Clinic brought out 7 qualities required, appreciated by the patients which they expect in their treating physician. I'm not going to mention them, but all those 7 qualities except the last one were human qualities. The last one was expertise in the profession. The 6 qualities mentioned by these patients in that survey was about human qualities. If this is there combined with the expertise that you have in this profession, I'm certain that you are going to be physicians respected, honored, looked up, loved by the patients. I take this opportunity to wish all the best to our cardiology and medicine department who have taken the trouble of organizing this workshop and tomorrow's conference. Wish them all success and wish each one of you the best in this conference. Thank you and God bless you.
Thank you, Father. I now request Father Richard Coelho, Administrator, Father Muller Medical College Hospital, to present a memento to our chief guest, Dr. M. Venkatraya Prabhu, as a token of our appreciation.
Thank you, Father. I request Dr. Roshan M., Professor of Medicine and Organizing Secretary, ISECON 2013, to propose the vote of thanks.
Good afternoon. It is my proud privilege to deliver the vote of thanks. I thank Reverend Father Patrick Rodriguez, Director of our institution, for permitting us to host ISECON 2013 workshop and conference. Thank you, Father, guiding us and presiding today's function. On behalf of the organizing committee, I thank Indian Society of Electrocardiology Central Committee for giving us the opportunity to host this workshop and conference in Mangalore for the first time at Father Muller Medical College. Dr. M.E. Prabhu, Dean, the KMC Mangalore, who was kind enough to come as a chief guest to inaugurate the session in spite of our short notice. Thank you, sir, for inaugurating the workshop and giving a wonderful message stressing on the human qualities. I thank Reverend Father Richard Coelho, Reverend Father Rudolph, Reverend Father Roshan Krasa for their constant support. I take this opportunity to thank Dean, Chief of Medical Services, Medical Superintendent for their moral support. Also, I thank the Vice Dean, all the HODs, the staff members of Medical College, and the faculty from neighboring Medical College who has attended this function. Special thanks to the faculty who are going to speak today afternoon, especially the Martin Green, who is an international speaker and a lot of inquiry for his talk. He is supposed to be a quiz master today. There was overwhelming response from the delegates, so much so that we had to change the venue from small hall to the bigger hall. Thank you for all the delegates who has made this success. Library staff, the nursing service department, nursing college staff who have cooperated in this program, I thank them all. I thank all the technical staff involved in internal, external arrangements at the venue. I thank all the print and electronic media for coming here and giving the wide coverage about our program. I thank all the organizing committee members from the Department of Medicine, Cardiology, postgraduates, interns, and student volunteers who has contributed to this workshop. I would have left someone unknowingly, and hence I conclude by saying a big thanks to all who are directly and indirectly involved in organizing this workshop. Thank you one and all.
With this, we have come to the end of today's inaugural program. I request Dr. H. Prabhakar to escort the dignitaries back to their seats.